I was asked about an anatomical facet replacement system. It's a lot of words. What does all that mean? Okay, your spine, we've talked about this. You have a disc in the front and you have two facet joints in the back at every level of the spine. Remember, your disc can degenerate or your facet joints can degenerate, or all three can degenerate. We're doing studies on anatomic facet replacement systems to replace arthritic and severely degenerative joints, to see if we can't replicate and maintain motion of the facet joints that are arthritic or degenerative, causing pain, similar to how discs cause pain. It's under investigation right now. It is not FDA approved at this time. We'll see when the jury is in how well they're doing. Until then, you have to seek out an FDA study to get it.